baby! Spud here. I've met a lot of people, and I've played some too. And there's one thing I know. People like to talk. Spud on TV. Now you're talking.
And stay out of the Woolworth.
Go grab a cup of coffee, because we got to talk.
And if you're looking for great service, we absolutely got that.
Yeah, you right. It's the Spudcast. That's where you at.
What is venous insufficiency? Do you know? We've all had that uncle with the big bulgy veins, or an aunt, those little purple lines in their legs, you know. Well, those can be signs of a really big problem that can run a whole lot deeper than you think. We're thrilled to have as our guest today one of the country's top experts in this field. He's a doctor other doctors see for treatment from La Bella Vita Vein Center, Dr. Randall S. Juleff, because now you're talking. How was that intro, huh? The other doctors come. Actually, other doctors do refer to you all the time, don't they?
We've had a number of doctors come in. You bet. Yeah.
Well, I mean, what you do is, well, we're going to get into it all that, but I mean, when I went and talked to you, and then you guys examined my leg, I was stunned. I think I was even more stunned than you, because you took one look at my legs and go, "There's something wrong with you, pal," and then you did the thing on me and found out it was nothing. So, but that was good. Now I got to go find what else is wrong with me, but. You know.
Yeah, well, right. I said, gee, there's got to be something wrong with this guy.
Something wrong with this guy.
I don't know whether I was talking about your legs or not, but yeah, you're absolutely right. Your legs have many of the signs and symptoms of what we treat, venous insufficiency. Now, occasionally we're surprised and we find that people don't have that defect.
I'm a freak, man. What can I say?
I wouldn't say that.
Well,
but you're a lovable freak.
Well, yeah, I got the gift of gab. But the fact is, well, we're going to show a video in just a second. But you've been doing this stuff a long time, and yours is the first time I ever even heard the words venous insufficiency. I mean, in a sense, it's kind of self-explanatory, but not completely, because it's a lot more complicated than just that. But what exactly is venous insufficiency?
Well, venous insufficiency just means that the veins in the legs are not functioning the way they should. Now, I'm not surprised that you haven't heard about it, because although there's a great number of people out there with this problem of venous insufficiency, it hasn't been well addressed over the years, because the remedies before were not all that palatable, or
people would rather put up with it, with the pain or whatever
than
it was.
be treated. In the old days, we did vein stripping. It was a surgical procedure. People were in the hospital for several days, and all of that has been replaced by very minimally invasive procedures that we're able to do. Yeah, we'll see clips. But yeah, venous insufficiency has to do with the fact that the blood in the legs is not returning back up to the heart the way that it should. Veins carry blood back to the heart. Leg veins are a little different, because they have to carry the blood back up to the heart against gravity, since most of our life is in an upright position. The way that that's accomplished is by one-way valves in the vein that keep the blood moving up. And typically when somebody has what we call venous insufficiency, it's a failure of those valves. And when the valves fail, then the blood starts
is pooling
in the lower leg.
And I mean, now that can cause, well, first off, it can cause like swelling, because it's like a fluid, but it can also, I mean, the blood can get thick, it can start to clot, and blood clot, we always hear about the blood clot went to their lung and they died or something like that. Why? What happened to them? They had a blood clot, went to their lung.
Right.
So there's the problem more than anything else, I think, up front is just the proper diagnosis to begin with. I mean, I got these brown spots all over my legs, and it's got something to do with diabetes, but when you looked at them, you went, your veins ain't working right. And I mean, that's just one of the symptoms. Again, for me, I'm a freak. My veins are working pretty good. I mean, I'm old. I should not be as big as I am. I do have diabetes. But considering all that, my veins work pretty good. There are people out there, and we'll see in the clip we're going to show in a minute, the lady who y'all are inspecting, her legs look great.
Yeah,
I mean, there's no outward signs of nothing.
She's young and incredibly healthy.
Yeah.
But yeah, you're right. The first step is getting the right diagnosis, but actually even the step before that is people recognizing or understanding that their symptoms might be due to vein problems. You know, people that are out there that have the big ropey veins or spider veins, that's easy. I mean, most people know that, gee, that's related to vein function.
But if you have that kind of stuff, do you necessarily have venous insufficiency? Or are you more susceptible to some kind of blood clot that would travel because of those kinds of veins? Or
yeah, you're right there too. If you have ropey veins, you know, what we call varicose veins, virtually all of those people are going to have this underlying valvular problem, again, causing venous insufficiency. Spider veins, it's kind of 50-50. Often they do. Often, you know, people have spider veins only, and they come in, and we do an ultrasound, and we find out that they do have a substantial amount of, you know, functional deficit. But there's a whole host of other symptoms out there, and you're a perfect example of that. You know, you came in primarily with swelling. Yes. And also you've had some kind of brownish discoloration of the skin.
I would show y'all, but it's just too frightening. See, he's a trained doctor. He could put up with this kind of stuff, not me.
But, yeah, people see that in themselves, and they think, oh, you know, I've been out in the sun all my life, or
that's what I thought it was.
I'm just getting old. I mean, we hear that all the time. But yeah, usually there's a reason why that kind of thing is happening.
Well, let's start with, let's do the clip where the lady's getting her legs done. It's about a minute and a half. I don't know. This is now this is your guy David, right?
Yeah, this is David. He's our registered vascular technologist, and he's excellent at doing these studies. He's looking at the main vein in her right leg, the vein that we call the saphenous vein, and we're going to have a shot on the monitor here in a second.
I tell you what, you don't have any sound, but when he squeezes her leg, you can hear it whoosh in the machine right there. Yeah, what's he doing when he does that?
Right now he's again kind of getting a visual of the vein, and that's the dark longitudinal tube there. That's the greater saphenous vein in this lady. When he squeezes the leg, that pushes the blood up. And what he's looking for then is the part of that curve that's showing that after he squeezes the leg, the blood goes up, it then goes down. That's what you should not see. There's another picture of the veins in the leg, and the vein is that dark circle.
Yeah, it's strange because you're holding the thing from the side, but it's like you're looking down the veins. It's weird how this machine works. It really is.
The first part of that curve there is him squeezing the leg and the blood going up, and the second part of the curve is actually the blood, visually, in waveform kind of.
Now
fashion.
we were talking about her legs. I mean,
yeah,
she's got nice legs. You don't see any marks on them. I know she was in pain. She's a runner. I think we talked afterwards. I mean, how many years did they just chalk it up to you got muscle spasms because you're a runner?
Very possibly. Yeah, very possibly.
Well, what brought her to you?
She did have some varicose veins also. So I think that was her connection. But she, in addition to that, again, she had all of the symptoms that people don't necessarily connect with, venous insufficiency, which is achiness, heaviness, fatigue. The legs just get tired quicker than they used to, swelling, and this kind of stuff. But the other thing about the symptoms is that they come on so slowly.
Yeah.
And over such a long period of time that people just get used to it, and they don't, they're not thinking, gee, something suddenly changed.
Well, see, like hypertension is the quiet killer, where you don't really know you have it till you get that. Can you go to the doctor and they take your blood pressure, would you take the blood pressure around my calf? Is that going to some indication of the problem?
Unfortunately, no.
That won't
now, you can do a blood pressure in your leg, but that's going to be taking the arterial blood pressure, the same blood pressure that you get when you do the cuff on the arm.
So it had no effect whatsoever.
But no. The only and the best way to look at vein function is with the ultrasound, the way that we saw David doing that.
All right. The options, and we have other clips we're going to go to because the lady that you're actually doing this. I was watching you do that and going, oh man, this is too weird. I mean, it's a fiber optic cable with a light on one end, and you're in the vein. You've got a shunt to go in, and we're going to see it all, and it's it's wicked.
It's fun.
It's fun to you. To me, I don't go, if I'm feeling on that, I mean, I'm watching you give shots to her too, and we'll get to that clip into a minute. But
By the way, I wanted to mention one thing with respect to symptoms, and you touched on it before, but this is probably one of the most important points for people with venous insufficiency. You mentioned blood clot formation, and people with venous insufficiency do have a higher incidence of something we call DVT, deep venous thrombosis, blood clot, and those are dangerous types of blood clots and those are the type that can break loose and go to your heart and lungs, and they can kill people suddenly. So that's one of the probably most important points that we.
Well, it's the main reason you shouldn't ignore this. I mean, you shouldn't really ignore any health issue, but this is the type of thing, like you said, it doesn't. It's like hypertension. You don't really know it's coming, but once you know it's there, you need to deal with it. Yeah. Once you know this is here, you need to deal with it because, it's not like having a heart attack and dying. You can die from this, and nobody would ever see it coming.
Right, exactly. It can happen extremely suddenly. There's no.
And how big a clot? How big is a clot? I mean, is it like the head of a pin? Is it a long tube or something?
Well, the clots that kill people can be pretty big.
I want to think.
Because what happens is that typically what happens is that a clot can form in a varicose vein, for instance. And we call that phlebitis, or
I had that on my list. What is phlebitis?
Yeah,
so that's what that is.
Superficial thrombophlebitis is the technical term, but people know that as phlebitis. And that creates a blood clot in a very superficial vein. Now, if it just stayed there, that'd be fine. I mean, it creates a little bit of inflammation and pain. But that kind of clot can then propagate from a very superficial location to a deep location. There are deeper veins in the leg, and that's why we call that a deep venous thrombosis, DVT. And those are the ones that are dangerous, can break loose and go into the heart and lungs. But those clots can be, they can be good size. They like that, and because it's filling up the deep vein of the leg, for instance, and that can be a pretty good sized clot.
Let's go back to the video and let's see somebody has a little more. Intense? That's not the right word, because I got to tell you, this lady here is resting pretty comfortably. What is she there for?
She has venous insufficiency. Now we're working on what we call the small saphenous vein that goes up and down the back of the calf. So that's what we're looking at. To the left of the screen is her foot with a little blue booty on it.
What's that? Now that is a fiber optic cable?
Well, no, that's a laser fiber. Okay. And we have a light at the end of it. That light is not the actual laser energy coming out. That's just a guide so that we can see where in the vein it is, and it helps us kind of guide the fiber through the vein. So we also use ultrasound. That's the laser machine itself. Yeah. It's a machine called the Cool Touch, and we use a specific kind of wavelength that attacks a certain molecule that works the best to close these veins down, which is what we're trying to do.
So close the vein down. I mean, you're not like removing the vein. You're opening up. You're opening up and making the valves work.
Well, no, actually, we don't do that. The valves in the veins that we're treating these days are so tiny that we really don't have the technology to actually go in there and surgically repair the valve. Okay. So what we want to do is we want to eliminate those abnormal flow patterns. In those veins, the blood is going down. Yeah. We don't want it to go down. So we close that vein. Now, the good part about it is that our legs, as well as most of our body, we have oodles of extra veins. So the blood, we close the vein down. The blood that would otherwise be going through that vein gets rerouted to other normally
functioning. It just does it on its own.
Automatically your body just does it like that.
So that vein just doesn't exist anymore. You haven't removed it.
No,
you just tied it off. It's like,
in the old days, we mentioned surgical vein stripping. We don't do that anymore. It's very traumatic. The vein stays in. We close it down. Now, over the course of a year or so, your body sort of breaks that vein down, and when we look at these veins a year later, they're just a little, fibrotic thread.
Okay, let's go back. Let's see the next batch the next, here we go. What now? All those little dots. What are you tapping your leg? Because I remember you telling her, okay, a few little sticks.
Things, yeah. We need to surround that laser fiber with numbing medication. So we start out by making a few little, dots on the skin, and that's where we're going to go in with a bigger needle that we'll see here in a minute. I'm tapping her leg just to distract her. That's all.
Okay.
Okay. It
well,
makes it a little more.
that picture. Okay. So that numbing medication. This woman was laid out and comfortable the whole time. I mean, y'all gave her obviously something. So you're shooting her full of pain numbing medication right now, but she never seemed to be in distress the whole time we were there.
No.
From the time you put the shunt in, the whole shebang. I mean, she had no problem. She go, go ahead, take pictures. We're good.
Yeah.
So I mean, this, for one thing, people shouldn't be afraid of these procedures because they're basically, nothing's painless, but I mean,
they're not absolutely pain-free.
But they're like
there's a little
maybe.
bit of discomfort,
Yeah.
but it's very little. We do a lot to we have people take a little Valium before they come in, so that sedates them a little bit. But most people aren't like out.
No, wasn't.
They're awake.
She was talking.
But wherever we're going to go in, we put in a lot of numbing medicine. We distract them, and we do a lot of things in an attempt to make it as comfortable as we possibly can. And 99.9% of individuals have no problem whatsoever. Yeah.
Both the ladies we
That's
talked.
typical.
Yeah.
That's typical.
Let's do the last one. I know we had 3 things. Okay, so you've numbed her. Now what you're doing? You're looking for the actual.
Well, now we're putting a lot more of the numbing medication in, and I'm using that bigger needle now through the little dot where we had already numbed.
Yeah.
With a tiny needle.
But you're not touching the actual vein while you're doing this. This is all surrounding it.
This is surrounding the laser fiber.
And that's what the ultrasound is, to make sure you're exactly what you're doing.
Yeah, I'm watching what's going on. Now, in there you see what I'm seeing with the ultrasound machine. All of the black areas, those are the areas where that fluid is going in around that laser fiber. The laser fiber is that white dot in the middle of the screen there. So you can see all the black fluid going in around it. So we have to surround that fiber pretty well because
look at her. She's fine.
Yeah.
She's not asleep.
No, she's awake and talking, and
She got up and walked out with no problem. I'll tell you that.
Absolutely.
So, how long from the first time that lady came in and told you she had a problem till you were able to diagnose and then treat there? I mean, is this something like, it's not like an emergency room. You show up here and go, oh man, your veins are a mess. Unless you do that ultrasound and you find one of those big old clots, then I'm imagining you go, oh no, we got to work on this today. But I mean, what kind of time frame are we talking about when somebody first shows up until they go through that kind of procedure?
Well, unfortunately, the main limitation is the healthcare system, because most insurance companies don't allow us to see the patient, diagnose the problem, and act on it. The insurance companies unfortunately want us to treat patients for some period of time, so-called conservatively. And theoretically, what we're doing is that we're proving to the insurance company that other modalities are not going to fix this problem.
But sometimes you have modalities that's like you're going to go through a treatment that, frankly, if you'd have just let me do this procedure that they were prepared to do, she'd be done, we'd be done, you would come out cheaper. But it's like that's But they get a job at the insurance company. They want to figure out how they work.
Yeah, they don't think that way.
No, obviously.
So that's the main drawback, and sometimes it's frustrating because people, they come in, they have finally identified a problem with their legs that they want to have attended to, and sometimes it takes people months to kind of make the decision to come in because they're not sure, or they think, oh, it's just a cosmetic problem, or they've been told. That's
Max
just a cosmetic.
Factor is a cosmetic problem when you're dealing with your legs. You never know.
Right.
Let me ask you this now, because you were talking about other things and this kind of stuff, how I used to strip the veins out.
Yes.
I mean, I'm always reading stories about politicians not being able to keep up with this fake marijuana and that kind of such. Though technology always seems to surpass the laws because it's a slower process. What is the technology? I mean, from 10 or 20 years ago, 10 years ago now, what do you think it'll be in 10 years from now? Like, you don't have the technology to fix those little valves in 10 years, considering the growth that you've seen in the technology, in 10 years, will you be able to fix those little valves and not have as much removal, or
Maybe
20 years from now?
More likely 20, but I doubt 10. But in 20 years, gosh, like that's a huge amount of time.
How fast does this stuff go? You know, I mean,
Exactly.
I speak to people talking about, oh, and they're already figuring out artificial intelligence or robots. I just read an article where a robot just won $1.8 million playing poker. I'm going, how come I couldn't have you for a roommate when I was in school?
Right.
You know, but I mean, you have to keep up on top of this stuff too. You know, so you can't just go to the big box store and buy another laser and do it. I mean, you have to go through.
Well,
that much more training.
You know, most of my career was spent doing open heart surgery and vascular surgery, and it was about 5 or 6 years ago that I decided to focus all my time on venous. And a big part of that decision was because of all of the new technology that had come on the scene, let's say over the last 10 to 15 years. You know, again, 20 years ago, all we had was vein stripping, and you know, that wasn't very palatable for the patient nor the doctor, you know. So we've had a tremendous amount of new technology specifically to treat venous insufficiency in the recent past.
Because it's a much broader problem than people even suspected before.
Well, it's a much more common problem, yeah definitely. Now, you know, since that time, we've had several new things come out, I think, with respect to the technology. The newest thing is something that has been developed, that was just FDA approved over the past year, and that is to treat these incompetent veins with, for the lack of a better term, super glue. So there's actually a device out there that has been developed by a company called Medtronic.
It's not that big monkey coming up in there squirting a little bit?
No,
That'll work. No, that's
well,
stuff.
that depends. Some people might call me a big monkey.
Well, you know, they call me that and worse. I got about 2 more minutes.
Yes.
If I mean, this is a field like, and again, I never knew about any of this stuff till I talked to you. Okay. So like David, your tech guy. I mean, people should be considering this field. I mean, is this introduced in medical school, or you can go, hey, you know what? I want to be a medical guy, but I don't know what. Hey, man, learn how to use this ultrasound and treat venous insufficiency.
Sure.
Because you got a shop here. You're on the North Shore, and you got a place in Hawaii, and you're looking to do another one down here because there's just that many people that have those many problems.
Yeah.
You need some help, bro. Because you busy. You know, it's taken me 6 months to get this guy on the show just to make our schedules match. You know, so we need some more people doing what you do.
Yeah. Well, yeah, you're right. Vein care is becoming a much bigger subspecialty, let's say, of vascular surgery as the years are going by, and we have a board certification process now, which wasn't in place 5-6 years ago. They are developing training programs for medical students that want to go in the direction of vascular surgery and vein care. So yeah, all of that is being developed even now. Sure.
LaBellaVitaVein.com to find out how more about you.
Yes.
You can also just Google up venous insufficiency and read up on stuff like that and see what the symptoms are.
Sure.
But don't fool around. Get an expert who can tell you what to do and tell you how to fix this, because these problems could lead to something much, much worse later on if don't put it off.
Yeah, absolutely.
Dr. Randall Juleff. Well, I appreciate it. Finally, 6 months getting you on, really. But
My
you know
pleasure.
what?
I'm happy to be
You're a
here.
busy man.
Anytime.
Well, 6 months from now, maybe our schedules will mesh again. Yeah. Okay, coming up, talking about a group of local students who are really exciting in science and engineering. Maybe the next Dr. Juleff? I don't know. We'll see next on this podcast.